All right, so welcome to AANMC's Naturopathic Medical College Virtual Fair. We are going to have a number of different things today that will be here for you to help you get the answers, hopefully, that you need to spark whatever career journey is going to be next for you. So with that, welcome. You all should be in listen only mode, so please keep yourself unmuted. You can turn on your cameras if you would like. If you have questions during the course of this event, please use the Q&A function, not the chat. It'll be a lot easier for us just to monitor the questions and so on as we go along. Oh, you know what? There is no Q&A because we're not in a webinar. Never mind that. Strike that. Please use the chat for questions, and Joanna, who is helping along today, will be monitoring the chat. So there was a question if there are going to be captions. I believe you can turn on captions yourself for the event through your own personal Zoom. So I believe that is an option within Zoom for you to turn on captions. We are recording this forum, and so we will have recordings available. If you have any additional questions, you can pop them in for Joanna in the chat, or you can email us at info@aanmc.org. So we're going to just launch a little poll and see who is joining us today. So where are you coming from? Where'd you joining? How'd you hear? And any of the future events that you'd like to attend, or if you have any questions about further events. All right, so here's boot camp. All of the terminology, all the little tidbits for you to make a productive day. And feel free, if there are questions, pop them in the chat and we'll hopefully try and get to them all. So naturopathic medicine is based upon 6 principles. All professional designations usually have some core philosophy. And so core to naturopathic medicine are these 6 principles that really are the unifying agent across anybody who considers themselves a naturopathic doctor. So first, do no harm really is an ND's focus in providing the least harmful therapies whenever possible. We honor the healing power of nature. So we recognize that oftentimes things that are within us and around us have the ability to heal us. We focus on identifying and treating causes. And so what that means is, rather than being a symptom-focused type of medicine where you diagnose something, you find out what is wrong, and then treat the wrong thing, we focus on the whole system and what may be interconnected, what are different components of the person that and their environment that may be contributing to the illness or whatever symptoms it is the person is having. So symptoms for us are more like a warning sign. It's like the check engine light that goes on in your car. Well, you don't just unplug the check engine light, you find out why the check engine light has gone on. And so naturopathic doctors will serve as teachers for our patients, helping them learn how to stay well, learn about their bodies. We focus on treating the whole person, and sometimes that incorporates their community as well. And then prevention. Prevention is really key. And so for us, focusing on prevention of illness is really one of the highest things that we should be able to try and do. So how naturopathic doctors think. So this is the therapeutic order of naturopathic medicine. And it is really more of a framework and a guideline for how we integrate all of the things that you learn in naturopathic medical education into patient care. And so what we focus on, so you'll see what is the bottom of the pyramid. The bottom of the pyramid is where we're going to be spending the majority of time with clinical education. And so we're establishing what is needed for optimal health. What are those root things that really need to be in place in order for people to be healthy? And then from there, we move up in hierarchy for things that are a little bit more invasive. So simulating health, self-healing may incorporate different types of physical modalities, manipulation, hydrotherapy, and so on. And at the very, very top are higher force interventions, and that would be things like drugs and surgery. And so often there are all these misconceptions about naturopathic medicine. Oh, you're anti-conventional established medicine, or anti-drugs, or anti-this and that. And it couldn't be farther from the truth. Honestly, we study and we learn about all of this, and it's really just what is most appropriate for that patient at that moment in time. So how do you spot an ND student? ND students look like all of you, look like me. They're all ages, all backgrounds, but often people who have a unifying philosophy of approaching patient care holistically. And so with that, whoops, went too far here. There we go. So with that, the students are often really excited about things like nutrition, recognizing that exercise and stress management and holistic lifestyle and addressing the root of the issue is important. Oftentimes there are folks that maybe have different cultural backgrounds, or have traveled, or have recognized different healing pathways, or maybe you were a patient yourself and you have experienced this, or a loved one was a patient and you've experienced, oh my gosh, there are other ways of healing that really work and can be powerful. So all of those things are things that we see in our students, oftentimes, very academically successful. It is medical school. You got to be able to hack med school. But, all ages, we find folks right out of college, we find folks who are career changers. And so, there is no too old to be a naturopathic doctor. And we see a real broad stroke of folks. They're undergraduates, they're former patients, as I said, they're travelers, and come from all different types of majors. So biological sciences is the majority, but then we've got liberal arts and healthcare and behavioral sciences, and then folks from just many different types of backgrounds. I remember when I was in ND school about my classmates and the profile of my classmates, and they were in all different types of backgrounds. We had folks that were in general pre-health tracks. And then we also had people who were, who had other careers before: accountants, construction workers, engineers, and so on. So there really is no right and wrong pathway. It's your pathway. So the curriculum, it's a 4-year medical education. The first 2 years are predominantly the biomedical sciences, ologies, as I like to call them. And then you go into clinical education, where you are learning diagnosis and treatment and laboratory diagnostics for all of these things, in addition to all of the naturopathic sciences that you're going to get in ND school. And so there are clinical rotations that are part of that, a minimum of 1,200 hours. There's a team-based approach. It is interdisciplinary, which means that you're going to have different types of practitioners that you're working with: naturopathic doctors, chiropractors, acupuncturists, physicians, nurse practitioners, PAs, and so on, really getting to understand this whole system that we work within. And so some of the naturopathic therapeutics that are used include nutrition, mind-body medicine, lifestyle counseling, homeopathy, hydrotherapy, botanical medicine, and others. And so there are prerequisites. I always tell folks, and you're going to have a great chance today, if you're able to talk to the admissions counselors, and they will be able to help you understand what prerequisites you need. There have been some shifts in prerequisites given the pandemic, and so I highly recommend making an admissions appointment for yourself. Have even an unofficial transcript ready to show them, so that you can find out what you need, and get yourself on track. So some of those prerequisites can include biology and chemistry. There may be some psychology and so on, but again, make an appointment with a counselor so that you can understand what is best for you. They will look at your GPA. They're going to look at your prerequisite courses, and the MCAT may be reviewed if you've taken it, but it is not required. And so there is a naturopathic central application service that is available for CCNM, Boucher campus, and Toronto campus, and SCNM. They will also request your transcripts from all colleges that you have attended, letters of recommendation, and in-person interviews may be required, although many of the schools have been allowing for virtual interviews, especially given the last couple of years that we have been in. So oftentimes I'm asked, what is the difference between naturopathic medicine and other primary care doctors or people who practice primary care? And so honestly, we all get a very strong foundation in providing for primary care. And primary care means, and we just had a webinar on primary care if you are interested in that. But primary care does really involve just being the entry point into naturopathic practice. And so primary care training incorporates diagnosis and treatment and patient management, professional communication, interdisciplinary management, and so on. And the requirements and coursework are very similar across all of these. There are, requirements for in-class instruction and so on, pharmaceutical training, and contrary to popular belief, NDs do get pharmaceutical training. So there are years in residency training. And so for residencies, naturopathic medicine, it's an option. It is not required, but it is optional. And then with work environments, you'll find that NDs are working in many similar places that conventional providers may work in. However, we tend to not be hospital-based or in the pharmaceutical industry. And let's see, so career opportunities are another question that we often get. NDs are research scientists. They can be natural pharmacists and work in the multi-billion-dollar nutraceutical industry. They serve in public health. They serve as consultants to industries and corporations, advisors, educators, lecturers, authors, and clinicians. And so all of these are wide areas for NDs to serve. And then you'll see here that number of different areas of focus that are available for naturopathic doctors. And this came from our alumni survey that we conducted in 2020. But the thing that I think that is so cool about this slide is that you see the primary areas of focus, the main areas that NDs work on are going to be digestion, nutrition, women's health, immune support, mental health, and trouble with sleeping. And that goes back, if you remember that therapeutic order slide, it really does go back to the core of naturopathic medicine. So we are working on those foundational areas for us. Endocrinology, herbal medicine are also very strong areas for docs. There's about 22% that work with children, and kind of everything in between. And so you can specialize as a naturopathic doctor, or you can be focused in one of these specific areas. So various different employment settings exist for NDs. And in the US, most are going to be, and I recognize, so anybody who's paying attention right now, if you're paying attention, the math does not add up to 100. And that is because sometimes folks will work in multiple places. And so they might have a solo private practice part of the week, and they might be in a group practice another part of the week, or they might teach or do some other things in addition to naturopathic medicine. So that is why the numbers here don't add to 100. And the red is Canada and the blue is the US. So one thing that I think is really striking about naturopathic education and naturopathic medicine is career satisfaction. Now, I will say that you are never going to find 100% of people who are happy with the choice that they made in any career, whether it is law or medicine or dentistry or pharmacy or what have you. There, people change. Sometimes they learn more about themselves than they didn't know before they started school. And so we see a very high percentage of people who are satisfied in their choice to be a naturopathic doctor. It's really gratifying when you can align your personal philosophy and your personal passions with your career. Work tends to not feel so much like work then. So typical patient visits for naturopathic doctors are going to be a bit longer because we're getting deeply into the patient experience, understanding what is wrong with them, and kind of going more deeply into the root cause, and that takes time. So there is a complete biopsychosocial history, physical examination in laboratories, differential diagnoses, and referrals when appropriate and needed. So naturopathic medicine is a regulated profession. The naturopathic physician licensing exam parts 1 and 2 are required for practice in the US, and NCLEX 1 and 2 and or the CONO exam, which is the examination for Ontario, are used in Canada, and there's more information on those links. We can also send, and all of this is on the website as well. So these are the regulated jurisdictions in the US and Canada. So the teal is regulated, and the light and dark teal are all regulated jurisdictions. And then the blue is in progress. And so you'll see that there's a good number of places across the US that are actively seeking regulation right now, which is pretty exciting. So that is just about going to wrap up for us. We have 2 upcoming events that are coming this month and in July, and we've got the May, June ones just about ready to announce, so stay tuned. But coming this month, we'll be joined by Dr. Trevor Cates, who is a best-selling author, and she's going to grace us with her knowledge on hormones. And so that is really exciting. And then we're going to be talking with Dr. Terrence Manning in July about pain and different types of things that are used by naturopathic doctors to manage pain without pharmaceutical and opiate intervention. So if you have any questions, we're always here